fine, thank you. What's your name, please?
I am Omar Saho. The healthcare system of the Gambia, I would say it's very poor, if not the worst in the world.
Okay.
I don't know about other countries, but I'm speaking of mine. Yeah, we use traditional remedies here because I personally, especially among our old ages,
Okay.
I even once had a, push and pull with my mother.
Okay.
Because she's a diabetes,
Okay.
and you know how they can take advice from friends. How they can get advice from each other.
Okay.
So usually they use these traditional remedies for a treatment for diabetes and other deadly diseases.
Okay.
So yeah, we use it here.
Okay.
The number of poor people in the Gambia is more than those that are rich.
Okay.
So you go to the hospital with an expectation that you will have a medicine,
Okay.
and you get everything in free. You end up buying your ticket,
Okay.
the lab fee, and they end up referring you to go to the private sector to buy your medicines.
Okay.
So yeah, it's usually like that.
Okay. Do you usually use public or private clinics or hospitals?
Well, I prefer going to the private clinics because most of the time when you go to the government hospitals, you end up not having every basic needs that you need.
Okay.
Both the medicines, especially maybe if you're an asthmatic patient and you need an oxygen.
Okay.
So it's better you go to the private hospital, and I prefer going to there.
Okay.
And I have a lot of people who do the same. Yeah.
Okay. Have you ever had medical condition?
Yes, I once had this thing. I used to have seizures
Okay.
during my childhood.
Okay.
Seizures, yeah.
How was your experience?
It was very terrible. It was
Okay.
very terrible because it went to an extent that people were saying I was suffering from this, spiritual thing.
Okay.
Yeah. Yes.
What should be improved?
What should be?
Improved.
What should be improved? I think our healthcare system should be improved.
Okay.
Government need to look onto it very well, especially to provide the basic needs. The emergency treatments, the medicines
Okay.
for us the poor.
Okay.
Yeah, this is so terrible.
Okay. Okay. Which hospital do you suggest and why?
Well, I would recommend my community hospital.
Okay.
Though we have Banjul. Banjul is there, which is a referral hospital.
Okay.
So I recommend the place, but I personally recommend my community hospital, which is Sukuta Health Center, because it's the place that is closer to me.
Okay.
Before the ambulance will transfer me all the way to Banjul. So I believe if my community hospital have all the basic needs, it's not necessary to travel all the way to these other places too. So other people too might have to suggest them to Banjul and other districts. For my personal, gain and interest, I think my community hospital.
Okay. Thank you so much for your time.
You're welcome.
Really
You're welcome,
appreciate it.
sis.
Okay.
Yeah.